Hi, Stacy with Stalking Horse here. Going to talk to you today about Transitional Care Management, or TCM. We're going to talk about the definition and the codes that are used and some of the requirements. So stay tuned. See you in a minute. Hey, welcome back. Stacy with Stalking Horse. So we're going to talk about TCM, or Transitional Care Management. And TCM is really for patients that are transitioning from being an inpatient and now receiving care at home. So it's really about keeping the patient stable, addressing their conditions, their problems, and making sure that they don't end up admitted back into the hospital. And so there's two CPT codes for transitional care management. It's the 99495 and the 99496. And essentially those codes have some of the same requirements, but there's subtle differences in what needs to be documented and performed. One of the biggest things is that we need to make sure that there is a communication with the patient or caregiver within 2 business days of discharge. So again, patients, they may get discharged on a Saturday, and of course most practices are not open on Saturdays, so you wouldn't be able to get notification or know about the discharge until Monday. So you have 2 business days to make contact with the patient and or caregiver and discuss their transition home and set up a face-to-face visit. And then that face-to-face visit needs to happen either within 7 days or within 14 days. And what I mean by either or is just that depending on which code you're going to use would depend upon whether it needs to be within the 7 or the 14 days. So essentially no later than 14 days in order to be able to use a Transitional Care Management, or TCM, CPT code. Also, the next difference is going to be whether the decision making is moderate or high. So that's one of the biggest things that practices tend to forget about, is that the difference between the 2 codes, the 99495 and the 99496, is also about medical decision making. So the 99495 is the lesser service, which would require, of course, again, that communication within 2 business days. And then it requires a face-to-face visit within 14 days. And then after that, the requirement is that the medical decision-making is of moderate complexity. So then the 99496, the same requirement of the 2 business days with communication, but then the time frame for an appointment needs to be within 7 days. And then the medical decision-making would be of high complexity. So many practices forget about that decision-making piece, and they just think, okay, well, it was done within 7 days, so I'm going to do the 99496 instead of the 99495. But if the medical decision-making is not of high complexity, then that code selection is not satisfied for the 99496. So again, knowing the complexity is super important. And also that complexity can speak to the requirement for the number of days. If someone has high complexity medical decision making, then their conditions would obviously either be more exacerbated, more severe, more likely that they may end up being readmitted, which would then say that, hey, we need to get this patient in sooner. We need to make sure that we're helping them with this transition from the inpatient setting to home so they don't end up readmitted. And so again, that 7-day window, that then makes sense that if it's of high complexity, you only have 7 days, versus if it's of moderate complexity, you have the 14 days. So that's sort of the code differences. There is some additional work that can be involved with transitional care management outside of just making the phone call and then getting them in for a face-to-face visit. One important point is that a medication reconciliation needs to be done. It's very difficult, I'd say, in particular for the older population when they get discharged and they may be on multiple medications, for them to really understand now, what am I supposed to be taking? How much am I supposed to be taking? When am I supposed to be taking it? Especially if any medication changes were made in the hospital. that becomes super confusing for them, and also very confusing for their group of providers. They may have specialists that see them and primary care. So it's very, very confusing for the patient and also for some of the providers to kind of keep all of that in alignment. So transitional care management services with that medication reconciliation being performed is like so helpful to keep the patient on the right track, to keep them from being readmitted, and also to get the word out to the other providers what that new medication regimen is. So that's important. Also, any phone calls that may be needed to talk to maybe the caregiver or to the patient to give them repeated instruction, those are included in transitional care management. And it's important to note also that once you bill that TCM code, one or the other, the 9.5 or the 9.6, you can't bill another TCM within 30 days. So that code lasts within that 30 days. However, if they come back in for an E&M service, you are allowed to bill that in that period of time, but just not another transitional care management service. So essentially, if they end up being hospitalized again during that time frame, and then you bring them back in and you do the 2 days and then you talk to them again, if it's within 30 days of that first TCM, you are not going to be compensated and you should not be coding for that second TCM because it's within 30 days. The whole goal is, again, to keep them out of the hospital from being readmitted. And so this transitional care management helps to like bridge that gap in care and in understanding like, hey, we're going from the inpatient side to now being home. What do I need? What do I need at home? Again, what are my medications? Do I need any follow-ups with any of my specialists? Do I need any follow-up testing, any x-rays, EKGs, MRIs, anything that they need to have set up to ensure, again, that they are not readmitted and that their conditions are being managed? That's what the TCM is there for. So I hope that you found this video helpful. If you have any recommendations for future videos, please feel free to put it in comments below. Don't forget to subscribe to our channel, and don't forget, you heard it straight from the horse's mouth.